Nagaland State AIDS Control Society Barchuakali HIV or STI awareness upper state level intensified information, education and communication campaign 3.0 launch kurishe. Launching program the Agri Expo 4th Mile Chumukudi Mapra Luciaro special guest Minister for Health and Family Welfare P. Paiwang Konyak Tagishe. Paiwang Brajanashigi State 23,470 Manu HIV Asekode Dimapur District 3.29% of सबसे बिशी positive rate ase to bichide noklak 3.07% और चुमुगुडी मारे 2.01% ase. Paiwang Kushiki IEC campaign 3.0 laga success to programs labra nohina jan ho high kurabra measure kurubole lage. Paiwang bra Panchta Newton Health on bike outreach motorbikes be flag off kurishe. IB details sizable.
It is especially meaningful that we are launching this campaign today, 12th August, coinciding with the International Youth Day, because young people are central to our effort to prevent HIV and build a healthier community. I extend my sincere gratitude to our Honorable Minister for joining us today as a special guest and for his continued leadership and commitment to the HIV response in the state of Nagaland. I also warmly welcome our honorable advisor, our honorable MLAs. We are honored to have you all here today in our midst. I warmly welcome our Secretary, Health and Family Welfare, Madam, our PD Madam, our Mission Director, our senior officers from the Directorate, the CMO, district roam officers from the districts, the Disha team, and the frontline health teams from Dimapur and Chumukidima. As we begin these 9 weeks, let us work together, not simply to conduct activities, but to make every interaction count. To all the teachers and students, I request you all to kindly take the message back to your schools and colleges and spread awareness. As we launch this campaign today, let us remember that behind every statistics is a person, a family, and a story. Let us therefore ensure that no one is denied dignity because of their HIV status. No young person is afraid to ask questions, and no individual hesitates to seek testing, treatment, or support.
The first one is to increase awareness about HIV, AIDS and STI. NAWA has launched this campaign to improve awareness on this issue. Of course, we are having awareness programs several times, but again we need to enhance this awareness program on this very prevalent issue in our state. The second point is to promote preventive behavior. Another focus of this campaign is to encourage people to adopt safer practices and take timely preventive measures, thereby reducing the risks of HIV and STI transmission. Another point is to reduce stigma and discrimination. We used to say that we don't have any more stigma or discrimination, but in our society, we have still this stigma and discrimination in regard to AIDS and HIV and STI. Because stigma often prevents people from seeking testing and treatment. Thus, ISC activities will promote empathy, dignity, and acceptance from people living with HIV. Another focus point is to encourage early testing and treatment. By informing communities about available HIV and STI services, this campaign will help people to come forward for testing, counseling and treatment at early stage.
As awareness campaign can inform people about HIVs, about STIs, but our responsibility does not end there. When someone decides to seek information, testing or care, to respond. Our health needs do not exist in separate program compartments. A young person may need HIV and STI information alongside with other health services and reproductive health services. A pregnant woman may require screening for HIV, syphilis, and hepatitis B as part of her routine checkup. We therefore need to strengthen convergence across our different health programs and make better use of our existing health facilities and platforms to provide a basket of essential services. This is particularly important as we work towards the goal of the triple elimination of vertical transmission of HIV, syphilis, and hepatitis B. Every person who walks into our health center is an opportunity for us to screen, to counsel, to treat or refer. To the frontline health workers, I would just want to say and emphasize that is our nurses, our counselors, our outreach workers, our peer educators, our link workers, and other health professionals. You are the bridge between the communities and the health system.
As we look at the public health landscape, we are reminded that HIV and STI continue to pose significant challenges across the country and within our states. While medical advancement have transformed HIV from fatal diagnosis into a manageable chronic conditions through accessible testing and antiretroviral therapy, the social barriers remain stubbornly intact till now in our society. Stigma and discriminations are often more lethal than the virus itself. Fear of judgment stops people from getting tested, prevent individuals from seeking timely treatment, and forces vulnerable populations into the shadows. This campaign aims to shatter those walls of silence and fear. These aims can be achieved only with the involvement of all stakeholders through enhanced knowledge, promote safe practices, and eradicate stigma. Our youth are not just the leaders of tomorrow. They are the primary change maker of today. Through platforms like Red Ribbon Clubs, creative arts, digital storytellings, social media campaigns, and grassroots community outreach, we can bring a big change in our society.
It is true privilege to stand before you today. We are here for a state-level launch of the third round of intensified information, education, communication, campaign on HIV and sexually transmitted diseases like syphilis, hepatitis, and many others. And I cannot think of a more fitting occasion to launch this than today, as we observe International Youth Day. Today is about so much more than just launching a campaign. It is a moment for us to pause, look around, and reaffirm our collective commitment to safeguard the health, the dignity, and the ultimate future of the people of Nagaland. International Youth Day is a powerful reminder that our young people are not just the leaders of some distant tomorrow. You are partners in shaping the present. Your energy, your innovations, and your absolute resilience are among our state's greatest strength. The choice our youth make today will help map out the future of our entire society. That is why investing in your health, your knowledge, and your empowerment isn't just a social responsibility, it is the very foundation upon which the future of Nagaland will be built. As we observe this day, we must also be entirely honest with each other about the mountains we still have to climb. Friends, Nagaland continues to face a deeply significant HIV challenge. Right now, our adult HIV prevalence stands at 1.37%. It is a sobering reality that our state records the second highest adult prevalence in the country, second only to Prevalence. If we look closer at our district, Dimapur records the highest positivity rate at 3.29%, followed by Nagla at 3.07% and Chapulima at 2.01%. At present, Nagaland currently has estimated of 23,470 people living with HIV. Yet, even in the face of these heavy numbers, I am filled with hope. Our collective, relentless efforts are working. Since 2010, Nagaland has achieved an incredible 39.97% reduction in new HIV infections and a staggering of 80.21% decline in AIDS-related deaths. What does this tell us? It proves without a doubt that prevention works. It proves that early diagnosis saves life and that consistent, uninterrupted treatment yields results. The government of Nagaland remains completely steadfast in its commitment to strengthen HIV prevention, treatment, and healthcare. But the government cannot heal the society alone. Success demands the united hearts of every institution and every citizen. As we launch this third round today, let us renew our sheer goal to build a healthier, more inclusive Nagaland. Let us build a state where young people can access accurate information without shame, where testing is embraced without fear, where every person living with HIV is treated with utmost dignity, and where every expecting mother receives timely quality care. Let us build a Nagaland where stigma has completely no place in our homes, our schools, our churches, and our communities. On this International Youth Day, let us do more than just celebrate our youth. Let us walk alongside them.